Good morning. You're listening to WNHHLP 103.5 FM, New Haven's home for community radio. I'm Mubarakah Ibrahim, and this is Mornings with Mubarakah. We are broadcasting live downtown New Haven and streaming live on TuneIn Radio, newhavenindependent.org, and we're also streaming live on Facebook. You can go to Facebook New Haven Independent, or you can go to Facebook Fit Muslimah. That is my page where you will find us screening on both of the pages. It is a beautiful Wednesday morning here in Connecticut, and we have today with us a gentleman that I've actually been trying to get for a while. I've been thinking about this show for a minute, ever since I think I met you like 2 years ago at a cookout, and I was like, I can't remember his name. And so it took me a minute to find you, and just so happened I was riding down the street and my husband is like, there's a guy you've been trying to get in touch with. So with us today we have Jerry Smart. Thank you for joining me, Jerry.
Thank you. You're welcome. Glad to be here.
Today we are going to talk about a really intriguing topic that I think that goes under the radar. But first, let me tell you a little bit about Jerry. So Jerry Smart is an African-American single father and senior community health worker at the Transitions Clinic in New Haven, Connecticut. At the Transitions program, Jerry coordinates medical care and social service support for chronically ill patients recently released from prison. Becoming certified as a CHW has allowed Jerry to give back to the community where he lives and have concrete skills to help others in the community coming home from prison. Jerry has been able to channel his long-standing 15-year commitment to community work into expertise and a career as an advocate for justice-involved individuals. His experience at TCN has inspired him to pursue higher education, a degree in social work. Since 2012, Jerry has been a steering committee member for the Robert Wood Johnson Foundation Clinic Scholars Program and a community advocate for the clinic at Yale, a dual diagnosis intervention program for people who are mentally ill and have substance abuse issues. In pursuit of his dream of becoming a social worker, Jerry plans to take courses at Yale, Southern Connecticut State University. He is a board member of the Connecticut Bell Fund, the first charitable Bell Fund in the state. That is a lot of community work.
Yeah, must agree.
You are a busy man.
Yes, I am.
So I thought that what you do was really intriguing, and I'll tell you why it intrigued me is, for anybody that follows me or the show knows that, I have a passion for health and wellness. I am a health and wellness advocate, and I think the population that you deal with is really a population that it goes unnoticed.
Mm-hmm.
And so I have a personal connection to particularly that population and what you do, because my father was in prison most of my childhood, and he literally died 48 hours after being released from prison from a stroke induced by high blood pressure, and he didn't even know he had high blood pressure. And he died at 55.
Right.
And so when you told me what you do, it brought to my mind kind of like, if he had known, if he had had health care, because just because you have a screw up and you end up in prison or whatever doesn't mean that you aren't deserving of just the basic humanity of, having health care. Now, tell me a little bit about how you got into this work first.
Okay. Once upon a time, well, I'm a lifelong resident of New Haven. I haven't always been in this line of work, but I always had a passion for it. Once upon a time I was incarcerated That's over 30 years ago. But it took a long time for me to, this buy into change.
Mm.
You know, and why I say that because during the 80s and 90s, I was affiliated with Prison the Street,
Okay.
so you know what was going on over there. And I just kept going back and forth, back and forth. But I met this individual. His name was John Goria. Back in the I met him in the '80s when I got out of jail, and he took a liking in me, and he always encouraged me, to do the right thing. But I would go back to the street, then I stop, and then I get back with him because he used to run an organization working with people coming home from prison, helping them find employment, housing, just getting themselves together. So, that's, how I got into it. Then, I worked for different organizations, in New Haven, like Project More, Youth Continuum. But how I got into healthcare, I was working for a grant um, for building bridges. It was a 3-year grant um, going into Gates Prison. I think that was in '09, working with people coming home from, getting ready to come home. So we were engaged in 3 months prior to them coming home, make sure that they have housing and employment.
So how do you become engaged with the people who are in prison getting ready? Is there a referral program getting ready for release?
Well, first of all, I'm gonna tell the audience a little bit about Transition Clinic. Transition Clinic is a national network of 17, 18 clinics throughout the United States, including Puerto Rico.
Mm.
And I'm the face of New Haven. So I've been doing it for 8 years. So we have clinics in California, we have clinics in New York, Texas, like I said, Puerto Rico, just to name a few places where we at. And we work with people coming home from prison that have chronic illnesses. So when I say chronic illness, diabetes, high blood pressure, Hep C, HIV, mental health. And so what I do, I coordinate them services, make sure they have an appointment um, at our clinics, which we have clinics at Yale Primary Care on Howard Avenue, and also Cornell Hill Health Center on Columbus Avenue.
Question. So the transition clinic, it's a national network, but it's run out of Yale. So it's a network in itself. It's not a program of Yale or a program of.
No, it's not a program of Yale.
Okay, so
Okay. So basically, I work for the San Francisco Health Foundation.
okay,
Okay.
all right,
And our goal is TCN with Transition Clinic Network is to have a clinic in every state, every city throughout the United States. We have one in New Haven. We just opened one last year in Bridgeport, and our next goal to get one in Hartford and Waterbury,
okay.
and let's move on from there. So we use, Yale, New Haven Hospital allow us to use the clinic on Fridays. We have slots from 8:30 to maybe 12:30, and we see about 10, 13 patients that day. It might be like what we try to do. Our goal is to see at least 3 new patients and 8 returns. So, like I said, I've been there 8 years, and sometimes we got people who've been on a caseload for 8 years.
Okay.
And also at Cornell Hill Health Center, we utilize their clinic. They allow us to utilize their clinic on Thursday afternoon from 1 to maybe 5. And the beautiful thing about Cornell Hill Health Center, you have, it's like a 3. You get primary care. You need to see a dentist. You can see a dentist, and also you can see you need to see a mental health caseworker. You can see that also in the
Okay.
same day.
Okay. So how do people coming out of prison find out about your program, or do you is your program have to contact them, or are they like given options of joining?
Good question. Discharge planners in the prison when they get released, they contact us, or um, different providers throughout New Haven. Project Fresh Start, Easter Sale, word of mouth. I do in-reach inside the prison, outreach out in the community. So a lot of it comes from all around. People come home from prison. They might go to the emergency room, and then we get referrals from there.
Okay.
Because you get some people that who come home from prison that might have high blood pressure, and they come home, they don't have no medication,
Mm.
so they go to the ER, which you don't get good services anyway. One thing I learned once I got into this in the medical, cause once upon a time I didn't like doctors. I didn't like going to the clinic because I didn't trust them, you
Mm.
know. And
And what was that source of mistrust?
uh, 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 I think and not. I think because too many questions. When I that's the experience I had got the first time, asking me a bunch of questions. I knew they were not concerned, and I was like, I'm not telling these people my business, you know. Um,
Even though they just wanted to help you.
right. I just had a
That was just your mentality
yeah,
at
that
the
was my
time.
mentality back then. But
Okay.
once I got into healthcare and really understood it, um, now I really understand.
Do
And
you think that's the mentality of a lot of people returning home from prison?
I think so because everything built on trust,
Mm.
I'm just glad that I have a great team and a great team of doctors that I've been associated with and work with
Mm.
because they are very compassionate and they really understand the population that we work with
Okay.
and the population that they're coming home with because you're dealing with a population that's just really don't trust anyone. And then in prison, and I've been there before, it's not you don't get the best healthcare services in prison. Not only in Connecticut, but that's throughout the United States. People go in there healthy and come out sick,
Mm.
you know, and I see it all the time. So, um, and then another thing, the healthcare system could be very intimidating.
Mm.
So a person who's coming home who never really utilized a clinic or had a primary care doctor, it could be very intimidating.
And is your service free for the
Yes, it
inmates?
is.
Okay.
Yes.
And when you the goal for your service is to get them to see somebody within a certain amount of time,
Two
correct?
weeks.
Within 2 weeks.
Within 2 weeks.
What happens if can someone come to your program? I've been out for 3 months and I need to see somebody.
Yes. Mm-hmm.
Okay. Is
Yep.
there a limit of time?
6 months. We
6
try to
months.
see them within 6 months.
Okay.
You right?
Right.
Um, Even if a person was out a year, then they won't be part of transition clinic. But then I make them a referral at a clinic anyway.
Okay.
You know,
All right.
because a lot of people don't really know how to utilize the healthcare system.
This is true.
You know,
Not just people returning from prison. This
right?
is just
I mean,
confusing altogether.
and then you have to understand a lot of people who's coming home from prison, especially from our community. A lot of them really never went to a clinic or had a primary care doctor when they got sick. To go to the emergency room.
Right.
You
Right.
know, and you know, a lot of people don't like to deal with a lot of questions. And when you do go to make an appointment, there's questions you have to ask. Do you have insurance? What's your address? Your telephone number?
Mm.
A lot of people, how about a person don't have a address or a telephone
Can they still
number?
be seen?
It could be seen, but how do I contact you and let you know that you have an appointment? You know,
It's very true.
you know. So I do that, and also I work at the Ford Clinic on One Long Wharf. That's a forensic diversion program, and
What's
they
that?
do we do mental health over there.
Okay.
So when people come home from prison, we got a grant through Sampson, a 3-year grant, work with 300 people in 3 years, um, get them healthcare service, mental health over there, and then I do the primary care. So if a person got mental health, they see doctors and clinicians over at Ford Clinic, and then if they have high blood pressure or diabetes, for instance, it's a win-win situation because I get them right into transition.
So let's talk about the general. I would definitely want to talk about the mental health thing, uh, um, portion of it, but the general health. What are some of the what are some of the challenges of dealing with this population? Do they have do they tend to follow up? Do they have a higher or lower compliance rate? Like,
I
we
think
have.
we have a great show rate,
Okay.
you know,
Good.
um, at our clinic, and I think that plays in part with the community health workers.
Mhm.
You know, um,
So community health workers actually go and touch base with these people in the
I'm
community.
always in contact with them.
Okay.
That's part of the job.
Okay.
Um, you're in the community. I make contacts on the phone. You might get a person that um his high blood pressure is this high, extremely high. And the doctor might say, "Well, Jerry, I need you to be in contact with this person every other day, to follow up, make sure he's taking his medication, and get his numbers.
Mm,
Then I report back to the doctor, and that's good because a lot of people tends to not take their medication
mm,
because they're feeling good. Because I know that because I have high blood pressure. I'm always going to have high blood pressure. I guess because it runs in my family.
mm.
It's hereditary,
Okay.
and I have to take my medication. And I remember once upon a time I had stopped taking my medication. 'Cause I was feeling good, such and such. But it was consequences behind that,
Mm,
you know? And so the beautiful thing about, a community health worker, I could call you and then, talk to you about, um, what can happen if you don't take your medication, the consequences.
mm,
Or a person who have diabetes, what's your sugar level? I'm not, and it's good follow up, because a lot of people, we all are busy. And then, a person, when you're incarcerated, you don't have to worry about nobody calling you or you monitoring because, you're there. You just go to the infirmary, get your medication, go back to what
mm,
whatever, well, time for meds, time for meds. Out here, people have so much going on,
mm.
trying to find a job, housing situation, just getting readjusted back into the world. That I'm working with a person who did 35 years in prison, um, in the feds, and that's a long time.
Mm.
He's 65 years old. He went in
Wow.
as a young man, healthy. Um, was a boxer in the karate, no health issues. A year prior to him come home, he had a heart attack, two hernia surgeries,
Wow.
high cholesterol, diabetes. I mean, you name it, he has it.
Mm,
You know,
mm,
so a person like that. So I'm in contact with him like like every other day. You
mm.
know what I'm saying? Because you come home 35 years, you don't have no family support. 'Cause everybody, if they're not deceased, you don't really like nobody. So you have to get to know each other. So I'm saying, well, how do you get from Texas to New York? They took a Greyhound. They put him on a Greyhound bus, and then we got off at Port Authority. He looking for a payphone. So he asking everybody where are the payphones at.
Wow.
You know,
Wow.
and so a brother has tapped him on the shoulder and said, "My man, you just get home." He said, "Yeah, we don't have payphones no more." I said, okay, you
Wow.
know. So
Wow.
just getting readjusted, the stuff that we take for granted,
Right.
you
Right.
know, and it's just like the small things. People come home and one dude did 16 years. He came home and he had high blood pressure. Um, and his sister told him she had my car and I said, "Well, call Jerry so he could make you an appointment." He, she gave him the phone, but he thought it was the battery.
Wow.
Because when he left, you know,
Right.
had no big phones then.
Right.
He said, "Where the rest of the phone at?" I said, "That is the phone." So not only
Wow.
but they dealing with a lot of stuff. So a person like myself just help you connect with different things. You know,
Wow. Wow. That is some that. Those are adjustments that I actually really didn't think about.
Yeah,
But wow, things really have changed in the last 10 years,
yeah,
more or less like
yeah,
35 years.
right,
Things have changed significantly.
exactly. And
Wow.
while you're incarcerated, they don't prepare you for that.
Yeah.
They don't prepare you for these
There's
changes.
no transition of
No,
this is what you can expect when you go home.
exactly.
Mm.
You know,
Wow.
and and like I said, what we tend to do as a society, we say, well, when you get out, find employment and housing. Everybody just ain't ready to work. You
Mm.
know, we put healthcare on the back burner.
Mm.
And a lot of people dealing with a lot of stuff coming home from prison. If a person have some healthcare issue that prevent them from working, what
Yeah.
do we do?
Mm.
You
Yeah.
know, I mean, rather it's physically or mentally. You got a lot of people dealing with a lot of mental stuff too. You know, traumatic stuff they probably experienced in prison or prior to them coming to prison. You know, rather than
Mm.
a shooting or they got shot or whatever. So people dealing with a lot of stuff, rather they've been in solitary confinement for their whole bed. I mean, so people dealing with a lot of stuff that when they get out here, they just can't deal.
Mm. Mm.
You know.
If you're just tuning in, you're listening to WNHHLP 103.5 FM, broadcasting live from downtown New Haven. We are also streaming live on TuneIn Radio and NewHavenIndependent.org, as well as streaming live on the New Haven Independent Facebook page, as well as the Fit Muslimah Facebook page. And you're listening to Mornings with Mubarakah, and we're talking to Jerry Smart, who is a transitions clinic community worker, and he deals with the reentry population and getting them to see healthcare providers, hopefully within the first 2 weeks of returning home, correct?
Correct.
Right. And so once someone is enrolled in your program, they stay enrolled
Yes. Yes.
for as long as they need it.
As long as they need it.
Okay.
And that's a beautiful thing because it's not like, well, you only can stay here for 30 days or 60 days,
Yeah.
and none of it's mandated. Everything's volunteer.
Mm.
Um, and then, like I said, you got a team that I work with that's very, um, not only that we want you to stay home, but remain healthy at the same time.
Mm.
You
Mm.
know, and it's a job and it's a struggle. You know, for a person that who might be obese, a person that who might struggling with substance or who want to stop, you know, a person that who's a smoker, you know, so and got high blood pressure or whatever. So everything's a struggle when you start talking about the social determinants of health, you know, going back into our community and, you know, people that who really don't have the money to eat a healthy meals and have to go into these bodegas that everything that they sell in those stores contribute to
Right.
high blood pressure and
All of the
diabetes.
preventable
You know what I'm
diseases,
saying?
right? Yeah,
You know.
absolutely.
So you know, community health workers we play a major role. So we are the on the front line. And so if a person called me and said, well, Jerry, I didn't get my medication today.
No, so question: is the medication free in a part of the program, or do they have to pay something towards the
No, but
medication?
most everybody who come out, they have Husky,
Okay, all
you
right.
know, and Department of Correction been very good. Once upon a time, when a person came out of prison, they had to go down to DSS and
Mm-hmm.
you know apply for um, Medicaid, but now DOC make sure that's taken care of before they come home.
Okay, so that is that done like while they're in prison or just right before they're released?
Right before they release.
Okay,
And then if a person have need medication, they get a 30-day voucher.
okay.
So they come home so they could take it to any pharmacy
Oh,
and get
okay.
their medication. So what a person normally do, they come out, they have their medication, and then they call me, or DOC call me, or whoever contact me.
Okay.
First thing I ask them, do they have their medication?
Mm.
How much medication do you have left?
Mm.
Now, if a person say, well, I only have 2 pills left, I try to get them in that same week,
Okay.
you know.
All right.
because it's very important. Because when you had mentioned, sorry to hear about your father, but when you had mentioned him, you say he died a few days or a few weeks.
Like literally less than 48 hours after he was released.
And this is very important because this is research and this is nationally. People coming home from prison are 12 times more likely to die within the first 2 weeks of coming home from
Really?
prison. That's nationally. That's and you can say, well, how is that? Murder, suicide, overdose, and cardiovascular disease.
Really?
Yeah, yeah.
Wow.
Mm-hmm.
I had no idea
Yeah.
about that. Mm.
And this, so it's very seriously,
Yeah.
because a lot of people come home. I ain't gonna say a lot of people, you could come home, somebody, start using drugs, that's OD,
Mm-hmm.
which happens, and I've seen it happen on my clock,
Mm.
you go back to the same neighborhood,
Mm.
and
Mm. Then
you
you get
kill.
caught up in the same thing. I just recently returned from a conference, so I am on a board for the Institute of Patient and Family Services, and I'm on their diversity board, which was the theme of the conference last month in Maryland. And the keynote speaker, one of the interesting things that she was talking about, she was particularly talking about the opioid epidemic,
Mm-hmm.
and she said that we need to treat drug addiction as if it is a contagious disease. If
Mm-hmm.
you put people back in the same environment
Mm-hmm.
and nothing about it changes, then
Mm-hmm.
they are most likely going to fall back into the problem.
Right.
She was like, the environment makes a huge difference. How do you agree with that, and how do you overcome that when people are returning to prison and generally the environment they come from is the only one that they knew?
I don't know. I mean, I look at it like this, from my perspective, it depends on individual.
Mm.
Some people could go back, some people can't.
Mm.
I was a person that I used to sell drugs, I used to get high. So I was a part of that,
Mm.
you know. But um
But did you have to like separate yourself from the people, from the places, in order for you
I'm still
to?
in New Haven, I'm still in the neighborhood.
Okay.
But you just have to just change, I guess, your direction. When I say your direction to people, I could still walk on kids in the street. I live in the Ville, you know, it's still going to be all around me. I could go
Mm.
to Cheshire. If you want to get high, you're going to get high.
This is
You understand? You could
true.
send
You can
me
find it
wherever.
anywhere.
It's
Right.
going to be there.
Right.
You just have to um buy, like I say, buy into change,
Okay.
you know, and it's a challenge, because I deal with people every day that who um been clean for a long time and it's relapse, you
Mm.
know, and but it's up to the individual. I think it's up to the person. Some people might have to go to a program, um, but I just believe it is up to the individual, you know, because wherever you go, if you want to get high, you're gonna get high. Even if drugs is not there in that area, you're gonna,
Mm.
you know, you
Mm.
want to get high, you're gonna find it, and that's what you're gonna do.
Mm. Mm. Mm.
That's my opinion.
Let's talk. Let's just shift over a little bit to the mental health services that you provide.
Mm-hmm.
So, mental health services in general, for I think for all populations, have a stigma to it,
Mm-hmm.
particularly strong stigma for people of color.
Mm-hmm. Mm-hmm.
How Tell me about how that program works, and how do you help people overcome that stigma of wanting to get the mental health services they need?
Mm-hmm. Okay, over at the Ford Clinic over on One Long Wharf, um, that's what they work with. Got professional um,
Mm-hmm.
clinicians and doctors,
Mm-hmm.
strictly on mental health. So, myself and a young lady, Amethyst Smith, we the community advocates over there. So we meet with the persons who coming home from prison also first, and like I tell them, we all have issues, you know, and we are taught, special as in our community, mental health is like that's like a bad word. You're
Mm,
crazy. You're
mm,
insane.
mm,
You know, there's certain things that's going on in our life has to be addressed.
mm.
You know, and it's not a bad thing. You know, just talk. I mean, if you're going through something and you need to talk to someone, um, to get it right, you need to take advantage of it.
Mm.
And then you have a person like myself and Amitha that who lived that experience. Now you're dealing with us, and then we do groups in Amitha on Tuesday or mornings from 11 to 12, and then on Wednesday night from 5 to 6. And it's an open forum group just for the people that are coming home from prison. No clinicians, no doctors, and we just talk about the struggles that you deal with, and people relapse. You talk about that. It's a very informative group, and people just let loose.
Sort of just like a safe space that
A
they can
safe
just say,
space.
okay.
Nobody what's happening in that room stays in that room.
Mm.
None of the clinician business or doctor business. It just
And
and
about how many people do y'all normally get?
normally, on a Tuesday morning, we could get anywhere between 7 and 10 people,
Okay.
and Wednesday evening could be smaller groups, but that's all right,
Right.
because it was time when you probably only had one or two persons in that room, but you know what? It was a great group
Mm,
because the person was really going through.
mm,
you know,
mm,
and they needed that space and they needed that time just to let loose,
mm.
just air out all their baggage.
Now, for the goal for the mental health services, is that goal to get them there within 2 weeks as well?
As soon as they come out of prison.
Okay, so as
So, and
soon
what
as you
the
can.
unique thing about it, because the clinicians and the community advocates, we go into the prison, Cyboski and Willard, and do inreach. That's how we recruit them, and then the prison, like Monday, we had an escorted visit. What is an escort visit? So we recruited 4 people. Then they come to the clinic. We shut the clinic down, and then they come in the morning, say like 8:30, and then they meet the whole team. And they leave at 1, so they come with the correction officer, bring them there, and
And this is before they're actually released?
yeah, before they release.
Okay.
So now they know where they're going, and all New Haven residents, first of all. So they meet the team.
So they have to be a New Haven resident
Yes. Yeah.
and they're getting ready to be released from prison.
Well, I'm not going to say they have to be a New Haven resident, but coming back to New Haven.
Okay. So they get an introduction to the team before they're even released.
Yeah. Yes.
And is this for people who the prison is aware of a diagnosed mental health issue?
Yes. Yes.
Okay. So if they're undiagnosed, then this doesn't happen.
Right. Right.
Okay.
Now and then, I guess it's the Department of Corrections got scores of mental health from 1 to 5.
Okay.
4 and 5 is the highest, and I think we only take 1, 2, and 3.
Okay.
You know,
All right.
and they come.
So what are some of the issues, mental health issues in 1, 2, and 3? It could be what?
Bipolar, anxiety, depression.
Mm.
You know,
Okay.
so once you start getting higher,
Like suicide, schizophrenia,
yeah,
that's 4 and 5.
yeah,
Okay.
then they have to go to CHMC on Park Street.
Okay.
You know,
All right.
so you got different people that who are trained. I'm not trained in that area, so that's who we deal with. And also, I work on the weekends at for family reentry at the Dana House on Henry Street.
Okay. What's that?
That's a Department of Correction halfway house, 15-bed halfway house with people who have mental health issues also.
The 1, 2, and 3 mental
Yeah.
health issue? Okay.
Mm-hmm.
All right.
Yeah, so I do that on the weekend.
All right. So the people that you deal with on the other days are people who are not in halfway houses, or they're coming straight out. They're not going halfway house.
No, they're going. Well,
They're coming straight home.
no, they're coming straight home. But some of them be at Roger Sherman. Some of them
Okay.
be at Walter Brooks.
Okay.
Some of them be at the Sierra House.
Okay. All of those are halfway houses.
All those are halfway houses.
Okay. All right.
Mhm.
And so we have people watching from all over. So explain what a halfway house is.
This is like a residential house. You get released. You still normally you're on parole.
Okay.
But,
Which means you're monitored by the Department of
yeah,
Correction.
you still on the Department of Correction radar.
Okay.
So
But you're living in a house
you
with
live in a house,
other people who are on parole,
parole and probation.
parole and probation.
Yeah.
Okay.
So the goal is for you to, find employment.
So this is just a side note. So it's called a halfway house because you're halfway in prison because you're monitored, but you're out. Is that why it's called a halfway house?
You know what? That's a
Why
good
is it called a
question.
halfway house?
That's a good question. That's a good question. That's a good.
Because you're like halfway in jail.
Exactly. I just call them residential programs.
Okay.
You know, it's a residential program.
I was not saying residential program.
They go out and they get in. The goal is to gain employment, housing, and to try to get with a good support system. You know,
Okay.
some people succeed, some people don't. But like I said, the goal is, and I try. You just have to buy in the change. Everybody ain't gonna buy into it.
Mm.
You know, some people still gonna um keep some of the same ways. And like I say, it's hard because um if you've been doing the same thing, had the same attitude years, you're going in and out, in and out. Like I tell the guys, man, what's gonna make you change? How are
Mm.
we gonna stop this? How are we gonna break this cycle?
Mm.
You know, and a lot of people, they get frustrated, you know, and I believe everybody that who come home, they want to do the right thing, you know, but you got a lot of people who come home that's on parole, on probation, and that could be very overwhelming because a lot of people have to go to a lot of meetings, have to go to a lot of programs, and it stops a lot of people from looking for employment, or you're on a bracelet, so it could be very challenging.
And so,
You know.
do those things, those challenges, just related to being released, affect their mental health? Like, I got all of this stuff, responsibilities. I'm supposed to find a job, and I can't find a job because I got to go
I
to this
think it could. I
program, and
think it can.
yeah.
I think it can. 'Cause it could be very stressful.
Mm.
You know, I mean, imagine there's only 24 hours in a day,
Mm.
and you got all this stress on you, telling you to find employment, but then you have to go to this program, then you have to go to this program.
Mm.
You can't not drive. Then you have to use the transit system. Then I have to be over here by 2 o'clock, but I have to be back in the halfway house.
Mm.
So
Right. So hopefully that the bus will get you where you need to be in times to be back on time,
exactly,
and everything
exactly.
is close to monitored.
And then you're dealing with, like for instance, in one of the halfway houses, or the residential program, you got 60 individuals in there. So you can imagine all the commotion
The
and all the
personality
personalities
conflicts.
you have to
Yeah.
deal with that also.
Mm.
So um, it could be very stressful. I know it could be very stressful.
Mm.
You know. So when you talk about mental health, I know the guys dealing with a lot of stuff. Rather they address it or acknowledge it,
Mm.
or just hold it in. And I think a lot of them do hold it in.
Okay.
Because the people that who I see that have the mental health, those are the people that who was directed to us.
Mm.
A lot of people are dealing with it. They just just keep it to themselves.
Mm.
Now imagine you got people. They say 25 people get released a week to New Haven. That's 100 a month.
Mm.
I don't see none of those people. I don't know where they at. I don't know where they get dropped off. And for years, we're
Those are
trying
the
to find.
people who were not directed to you by the
Right,
DOC.
right. They
Okay.
just get released into the community, come
Mm.
back to New Haven. That's 25 a week. Imagine how many people right there have a chronic illness, a mental
Mm.
health illness,
Mm.
you know.
Mm. Yeah.
So if you release and you're not on probation or you're not on parole, you're on your own, you're going back into your own world,
Mm.
you know,
So how do those people find you?
word of mouth. Or to go to the emergency room,
Okay.
you know. That's how they find me.
Okay. All right. When we talk about um, the stigma of mental health issues, is there a way that people can overcome that? To so, do you have people that's just like, I'm not coming because I'm not crazy, and how do you help them through that to say,
Well, it's been cases that when I talk to an individual and say, "Well, I don't need to see a doctor," but because I'm not crazy, I'm just dealing with this and that. Not not just just talk to them like, yo, it's not about being crazy.
mm,
You know, I think you got some issues that needs to be addressed. You know, because if you keep holding it on, what's going to happen? You're going to go back out there. You're going to start drinking. You're going to start smoking. You're going to start doing stuff that's not good for you. You end back in jail. Well, you could go ahead and just talk to this individual. It's not like you have to do this for a lifetime.
mm,
You know, just get the steam off your chest, man.
mm,
And this, and but I think what's good about it because um and the good thing about having a person like myself and other community health workers, because we lived that experience, we
mm,
understood. So if I could talk to you as a real person,
mm.
you know, it's more easier for you to buy into it than first meeting a doctor, somebody you don't
Absolutely,
know, who really
absolutely,
don't understand the world you're coming from, basically don't even understand you.
absolutely.
My man, I sat in your seat before, so I understand where you're coming from. And my goal is to get you off the dance floor and onto the balcony. You know
Mm,
what I'm saying? Once you get on the balcony, then you bring the next person up.
mm,
You know what I'm saying? 'Cause a lot of us been on that dance floor,
mm.
you know. So we're trying to get to the balcony and take the rest of the people off the dance floor.
Now, do you have? I'm assuming that these services are for both men and women coming out.
Yes, men and women. So we have a female community health worker, Manya Harper, over at Transition, and over at the Ford Clinic we got Ametha Smith.
Okay.
She normally they normally work with the females.
Okay. All
You
right.
know.
All right.
So if they're not out in the community, they go up to York, you know, go to the appointments, you know. So being a community health worker, community advocate, you wear so many hats. It entails a lot,
Mm,
'cause you're doing home visits, you're out in the community,
mm.
locating people that you have not heard from or missed appointments. You
You
going
actually
to
go find them?
yeah,
Wow.
yeah. People that a lot of people might have to go see a specialist. In order way to get to go see a specialist, you have to have a referral from your primary care doctor. So that's why it's so important,
Mm,
even if you don't have a chronic illness, just to have a primary care doctor.
mm.
'Cause I tell a lot of them, I say, well, a lot of us look good on the outside, but we never know what's going on in the inside.
That's true.
You know, and a lot of times I go to appointments with a lot of people. A lot of people don't want to go to appointments by themselves.
Okay.
You
So
know,
that's one way for you to kind of like remove that barrier to actually give them that support.
exactly.
Mhm.
Or then we have individuals that's in the hospital. Then I go to the hospital and go see them.
Okay.
And how do we get that information? This is here you all over the place because see, the hospital have this system now. It's called Epic,
Uh-huh.
and that's like um if a person in the emergency room, if I go in the system, I know that my patient in emergency
Mm.
or the doctor, they email says Jerry such and such is in the hospital.
Okay. All right.
And it's a good feeling. And when you really don't have
Right. You don't
one
have
of your
support
corner,
system. Yeah.
and they see me walking there,
Yeah.
I'm
Awesome.
not being nosy. I'm just coming in to see how you doing.
Okay. All right.
I'm not sitting there for an hour. So I'm just coming through. Like, I know you're here. Um, whatever you need, whatever services medically, we got
Closer to you. So we are coming towards the end of our show. I want to thank you for just enlightening us on some of the issues that the reentry population face when it comes to their health and returning back home. If you could just How does one get in touch with you if they happen to see or hear us and they're saying, I just returned home and I need some help, some healthcare help?
Hmm. Well, I have two phone numbers. The first number is 203-836-9554. That's 203-836-9554. And the secondary number is 203-850-2449. That's 203-850-2449. And they just could call me, and I'll always answer my phone. Or on Friday morning, I'll be over at 789 Howard Avenue at Yale Primary Care. Or Thursday afternoon, Cornell Hill Health Center, um, Columbus Avenue. It's actually Jerry Smart.
Awesome. Thank you. Thank you so much.
You're welcome. Thank you.
Thank you, everyone, for listening. You've been listening to Mornings with Mubarakah on WNHHLP 103.5 FM, New Haven's home for community radio. And I want to remind you this week, as I do every week, to go about your week to be a voice and not an echo.